Open enrollment for KPPA non-Medicare eligible retirees begins October 1st and ends October 31st. This is not a mandatory open enrollment. It is voluntary and only necessary to enroll online if you would like to make changes to your existing coverage. We invite you to utilize our online resources for enrollment questions at kyret.ky.gov, as well as our call center at 1-800-928-4646. Virtual and in-person counseling is also an option and available by appointment only. We know your time is important, so don't forget we have a callback assist feature that will allow you to leave your telephone number and receive a call back without having to wait on hold while keeping your place in line. For specific benefit and coverage related questions, we invite you to contact the appropriate vendors directly for those questions. All contact information for every vendor associated with your healthcare plans are listed on our website. For example, monthly premiums or eligibility related to your coverage, you would seek answers at kyret.ky.gov. For information surrounding the Living Well Promise completion and fee, you will need to contact Castlight at mycastlight.com/mybenefits. Please note the online health assessment is the only way to complete the Living Well Promise. For information related to prescription drug coverage, formulary-related questions, etc., you would seek answers by calling CVS Caremark or online at caremark.com. The Prudent RX benefit is no longer part of the CVS Caremark pharmacy plan. For medical service-related questions such as deductible and cost associated with covered procedures, you would contact Anthem at anthem.com/KEHP. This will ensure you receive the most accurate and up-to-date information directly from the vendors that administer each particular benefit. What if a KPPA retiree or spouse is becoming Medicare eligible or turning age 65 in year 2025? KPPA retirees and dependents will be notified by U.S. mail by KPPA about 6 weeks prior to the date of your Medicare eligibility or 65th birthday. Detailed instructions on how to make this transition will be included in this mailing from KPPA. You may also view this excellent short video presentation on how this process works, entitled KPPA and the Transition to Medicare. This video is located in the Insurance section under the Qualifying Events page on the KPPA website. Health insurance plan choices are the same for the upcoming plan year. You can identify what plan you are currently enrolled with by viewing your Anthem ID card. Cost of coverage is not changing if you have 100% health insurance contribution paid by KPPA under the percentage benefit. However, costs may increase on some plans if you pay a portion of your plan premium each month. Please review our website for all specific premium information or use retiree self-service. We will briefly go over premium contributions for KPPA retirees in a few moments. There will be a modest increase in the deductible and maximum out-of-pocket amounts in all plans. The Living Well CDHP, Living Well PPO, and Living Well Basic CDHP will have changes to copays and coinsurance for emergency room facility benefits. A $250 copay, then a coinsurance of 25 or 30%, depending on the plan you selected. The Living Well CDHP and Living Well PPO will have a change specific to GLP-1 weight loss drugs. They will be covered at deductible, then 25%, or deductible, then 30%, depending on the plan selected. New Anthem ID cards will only be issued if you make a change in coverage. Visa HRA cards will only be issued for changes in coverage or when the current card expires. You can see your expiration date on your current card. No dental or vision coverage is available for non-Medicare retirees through Anthem. However, you can view optional coverage that you may purchase separately by visiting our website. Retired members eligible for dollar contribution who do not elect coverage through KPPA may be eligible to have premiums reimbursed for insurance coverage under a non-KPPA plan. To learn more about this retirement reimbursement benefit program, under Publications and Forms on our website, click on Books and Guides, then Health Insurance Reimbursement. For information on the Living Well Promise, please visit Castlight at mycastlight.com/mybenefits for more information. The Living Well Promise must be completed between January 1st and July 1st of each year. If you do want to make changes, online enrollment is the only available option for this enrollment period. You may access your account using your computer, smartphone, or tablet by clicking Login from the KPPA homepage, then Retiree Self-Service. All of this is available at kyret.ky.gov. If you do not complete an online enrollment form, you will automatically be enrolled in the same plan at the same level of coverage, whether it be single, parent plus, couple, or family plan. If you currently waive coverage and do not have insurance through KPPA, you do not have to do anything to continue to waive coverage for the next plan year. Effective January 1st, 2025, the cross-reference payment option is no longer available for new retirees who are not currently on a cross-reference plan. If you do need to submit forms, please log into your retiree self-service account by clicking Login anywhere on the KPPA website. Hazardous duty retirees with health insurance dependents must file a Form 6256, designation of spouse and/or dependent for health insurance. This has to be done every year, even if the open enrollment period is not mandatory for enrollment. The deadline is always November 30th. Online enrollment and form submission is the only available option, so please use the secure retiree self-service option by clicking Login anywhere on the KPPA website, then Retiree Self-Service. The Living Well PPO plan is still the health plan that KPPA will pay 100% single contribution rate on your behalf up to $1,105.54 if you have at least 20 years of service and are under the percentage contribution formula. This is the same plan and situation as last year that was approved by the KPPA Board of Trustees. For other specific percentage-based formula premium questions or any dollar-based formula premium questions, please visit Retiree Self-Service or the open enrollment calculation worksheets available on our non-Medicare KEHP 2026 open enrollment webpage. For a full listing of all plan rates and contributions, as well as calculation worksheets, they are all available online. What will my specific cost be? Our retiree self-service web portal is an excellent way of checking how much you are currently paying and what the cost of coverage will be if covering dependents, etc. Click Login from the homepage of the KPPA website to access. For questions regarding completion of the Living Well Promise, please visit Castlight at mycastlight.com/mybenefits. KPPA has no way of verifying whether or not you have completed the Living Well Promise other than the data that is sent by the vendor. This concludes our presentation for today. Thank you for viewing.